41. All cancers require surgical intervention for treatment. True or false? Answer: false. Rationale: while surgery is a treatment for many solid tumors, some cancers, e.g., leukemia, certain lymphomas, are primarily treated with chemotherapy, immunotherapy, or radiation, depending on the type and stage. 42. Patient education about chemotherapy includes teaching about infection prevention. True or false? Answer: true. Rationale: chemotherapy-induced neutropenia increases infection risk, so patient education emphasizes hand hygiene, avoiding crowds, and reporting fever to prevent serious complications. 43. Cervical cancer screening is recommended annually for women starting at age 18. True or false? Answer: false. Rationale: cervical cancer screening, pap smear or HPV testing, is recommended starting at age 21, every 3 to 5 years for women at average risk, depending on age and test type, per USPSTF guidelines. 44. Fatigue in cancer patients is always caused by anemia. True or false? Answer: false. Rationale: fatigue in cancer patients can result from anemia, but also from treatment side effects, metabolic changes, psychological stress, or tumor-related inflammation, requiring a holistic approach. 45. Targeted therapies attack specific molecular pathways in cancer cells. True or false? Answer: true. Rationale: targeted therapies, e.g., trastuzumab for HER2-positive breast cancer, inhibit specific molecular pathways or proteins in cancer cells, offering precision treatment with fewer side effects than chemotherapy. 46. Psychosocial support is unnecessary for cancer patients in remission. True or false? Answer: false. Rationale: patients in remission may experience fear of recurrence, anxiety, or adjustment issues, requiring ongoing psychosocial support to address emotional and social needs. 47. Hepatocellular carcinoma is often associated with chronic hepatitis B infection. True or false? Answer: true. Rationale: chronic hepatitis B infection causes liver inflammation and cirrhosis, significantly increasing the risk of hepatocellular carcinoma, a primary liver cancer. 48. Bone pain is a common symptom of early-stage breast cancer. True or false? Answer: false. Rationale: early-stage breast cancer is often asymptomatic or presents with a painless lump. Bone pain is more common in advanced stages with bone metastases. 49. Antiemetics are used to manage chemotherapy-induced nausea. True or false? Answer: true. Rationale: antiemetics, e.g., ondansetron, are standard for preventing and managing chemotherapy-induced nausea and vomiting, improving patient comfort and treatment tolerance. 50. End-of-life care in oncology focuses solely on physical comfort. True or false? Answer: false. Rationale: end-of-life care in oncology addresses physical comfort, e.g., pain management, as well as emotional, spiritual, and psychosocial needs, ensuring holistic support for patients and families. 51. Hodgkin lymphoma is characterized by the presence of Reed-Sternberg cells. True or false? Answer: true. Rationale: Hodgkin lymphoma is distinguished by Reed-Sternberg cells, large multinucleated cells seen on biopsy, which are critical for diagnosis and differentiate it from non-Hodgkin lymphoma. 52. Chemotherapy is the only treatment option for metastatic breast cancer. True or false? Answer: false. Rationale: metastatic breast cancer is treated with a combination of therapies, including chemotherapy, hormonal therapy, targeted therapies, e.g., trastuzumab, and immunotherapy, depending on tumor characteristics and patient factors. 53. Obesity is a risk factor for endometrial cancer. True or false? Answer: true. Rationale: obesity increases estrogen levels, which can stimulate endometrial cell growth, raising the risk of endometrial cancer, particularly in postmenopausal women. 54. A pap smear can detect ovarian cancer. True or false? Answer: false. Rationale: A pap smear screens for cervical cancer by detecting abnormal cervical cells, not ovarian cancer, which requires imaging, e.g., ultrasound, or tumor markers, e.g., CA-125, for detection. 55. Bone marrow aspiration is used to diagnose leukemia. True or false? Answer: true. Rationale: bone marrow aspiration and biopsy are key diagnostic tools for leukemia, allowing examination of bone marrow cells to confirm abnormal white blood cell production. 56. Radiation therapy can cause permanent infertility in male patients. True or false? Answer: true. Rationale: radiation to the pelvic area or testes can damage sperm-producing cells, potentially causing permanent infertility, requiring fertility preservation discussions before treatment. 57. Tumor lysis syndrome only occurs in solid tumors. True or false? Answer: false. Rationale: tumor lysis syndrome is more common in hematologic malignancies, e.g., leukemia, lymphoma, due to high tumor burden and rapid cell turnover, but it can rarely occur in solid tumors with high sensitivity to chemotherapy. 58. Hand-foot syndrome is a side effect of certain chemotherapy drugs. True or false? Answer: true. Rationale: hand-foot syndrome, characterized by redness, pain, and peeling of the palms and soles, is a side effect of chemotherapy drugs like capecitabine or doxorubicin, requiring dose adjustments and supportive care. 59. All cancer patients require a central venous catheter for chemotherapy. True or false? Answer: false. Rationale: while central venous catheters, e.g., PICC lines, are used for some chemotherapy regimens, others can be administered peripherally or orally, depending on the drug and treatment duration. 60. Palliative care can be provided alongside curative cancer treatments. True or false? Answer: true. Rationale: palliative care can be integrated at any stage of cancer treatment to manage symptoms and improve quality of life, even during curative therapies, not just at end of life. 61. Non-Hodgkin lymphoma is less common than Hodgkin lymphoma. True or false? Answer: false. Rationale: non-Hodgkin lymphoma is more common, accounting for about 4% of all cancers, compared to Hodgkin lymphoma, which is rarer and has a distinct clinical presentation. 62. Asbestos exposure is a risk factor for mesothelioma. True or false? Answer: true. Rationale: asbestos exposure is the primary risk factor for mesothelioma, a rare cancer of the pleural or peritoneal lining, often linked to occupational exposure. 63. Prostate cancer screening is recommended for women. True or false? Answer: false. Rationale: prostate cancer affects men, as the prostate gland is male-specific. Screening with PSA testing or digital rectal exams is not applicable to women. 64. A CT scan is sufficient to diagnose lung cancer without a biopsy. True or false? Answer: false. Rationale: while a CT scan can detect lung nodules, a biopsy, e.g., bronchoscopy, needle biopsy, is required to confirm lung cancer by examining tissue for malignant cells. 65. Immunotherapy can cause immune-related adverse events like colitis. True or false? Answer: true. Rationale: immunotherapy, such as checkpoint inhibitors, can overstimulate the immune system, leading to adverse events like colitis, pneumonitis, or hepatitis, requiring close monitoring and management. 66. Spinal cord compression is treated with chemotherapy as the first-line therapy. True or false? Answer: false. Rationale: spinal cord compression, an oncologic emergency, is primarily treated with corticosteroids to reduce swelling and radiation or surgery to relieve compression, with chemotherapy used for systemic disease control. 67. Stomatitis is a common side effect of chemotherapy. True or false? Answer: true. Rationale: chemotherapy damages rapidly dividing mucosal cells in the mouth, causing stomatitis, painful inflammation, which requires oral care and pain management to prevent infection and discomfort. 68. All cancers are preventable through lifestyle changes. True or false? Answer: false. Rationale: While lifestyle changes, e.g., quitting smoking, healthy diet, can reduce the risk of some cancers, not all cancers are preventable due to genetic, environmental, or idiopathic factors. 69. Hepatitis C infection increases the risk of liver cancer. True or false? Answer: true. Rationale: chronic hepatitis C infection causes liver inflammation and cirrhosis, significantly increasing the risk of hepatocellular carcinoma, a primary liver cancer. 70. Low-dose aspirin is recommended for all patients to prevent colorectal cancer. True or false? Answer: false. Rationale: low-dose aspirin may reduce colorectal cancer risk in certain high-risk individuals, e.g., those with Lynch syndrome, but it is not universally recommended due to bleeding risks and individual variability. 71. Multiple myeloma is a cancer of plasma cells. True or false? Answer: true. Rationale: multiple myeloma is a hematologic cancer characterized by uncontrolled proliferation of plasma cells in the bone marrow, leading to bone lesions, anemia, and renal impairment. 72. Chemotherapy-induced nausea is always preventable. True or false? Answer: false. Rationale: while antiemetics, e.g., ondansetron, significantly reduce chemotherapy-induced nausea, some patients may still experience breakthrough nausea due to individual sensitivity or highly emetogenic drugs. 73. Lymphedema can occur after radiation therapy for breast cancer. True or false? Answer: true. Rationale: radiation therapy can damage lymphatic vessels, impairing drainage and causing lymphedema in the affected arm, requiring compression garments and physical therapy. 74. Tumor markers like CA-125 are used to screen for breast cancer. True or false? Answer: false. Rationale: CA-125 is primarily used to monitor ovarian cancer, not breast cancer, which relies on mammograms, MRIs, or tissue markers like HER2 for diagnosis and management. 75. Hospice care requires patients to stop all cancer treatments. True or false? Answer: false. Rationale: hospice care focuses on comfort, and while most curative treatments are stopped, some symptom-relieving treatments, e.g., palliative radiation, may continue based on patient goals. 76. Pancreatic cancer is the leading cause of cancer deaths worldwide. True or false? Answer: false. Rationale: lung cancer is the leading cause of cancer deaths worldwide due to its high incidence and late diagnosis. Pancreatic cancer has a high mortality rate but lower incidence. 77. Thrombocytopenia is a common side effect of chemotherapy. True or false? Answer: true. Rationale: chemotherapy suppresses bone marrow, reducing platelet production and causing thrombocytopenia, increasing bleeding risk and requiring monitoring and possible transfusions. 78. A low-fat diet is recommended for all cancer patients. True or false? Answer: false. Rationale: dietary recommendations vary by cancer type and patient needs. For example, a high-calorie diet may be needed for cachexia, while a low-fat diet may benefit some breast cancer patients. 79. BRCA mutations only increase the risk of breast cancer in women. True or false? Answer: false. Rationale: BRCA1 and BRCA2 mutations increase the risk of breast cancer in both women and men, as well as ovarian, prostate, and pancreatic cancers, necessitating genetic counseling. 80. Pain in palliative care is always managed with intravenous medications. True or false? Answer: false. Rationale: pain in palliative care can be managed with oral, transdermal, or subcutaneous medications, as well as non-pharmacological methods, based on patient needs and preferences.